Hi, I'm Marty Cohn, and welcome to Grace Cottage Hospital's Healthcare Matters, a monthly show that brings you timely information about health-related topics. Grace Cottage Family Health and Hospital is an independent, nonprofit healthcare facility just located about 17 miles from Brattleboro in Townsend, Vermont. Grace Cottage provides area residents with traditional primary care, pediatrics, mental health counseling, 24/7 emergency care, inpatient rehabilitative care, a lab and diagnostic imaging, and outpatient physical, occupational, and speech therapy. It also offers free counseling services with their 8-member community health team. Grace Cottage mission is to promote wellness, relieve suffering, and restore health. Our guests today are Roger Allbee, Grace Cottage CEO, who will talk about the latest news from the healthcare facility, and Daigneault, a nurse practitioner who will discuss how you can develop a battle plan against ticks. Welcome, Roger.
Thank you, Marty.
So our first show, right off the bat, we got some alphabet soup that I'd like you to answer for us. There's this thing called, I understand, Grace Cottage, it's a federal designation, Critical Access Hospital, and a patient-centered medical home. What is a critical access hospital?
Well, in the 80s and 90s, there were a lot of closings of hospitals around the United States. And Congress understood that there was a need in rural areas of the country to have access for health care for people in this country. And so they created this designation. And basically what it means is that the hospitals are provided with a cost-based reimbursement that they can cover their cost of operating so that health care is available. In terms of patient-centered medical home, it's a national quality standard. And basically what it means is that our hospital and our family health center has gone through a very rigorous program on quality control, programs to address patient needs, and we are level 3, which is the highest in the country in serving patient needs.
Wow. All right, so here we are in Little Vermont, but recently Grace Cottage received a national recognition, Top 20 CAH, Critical Access Hospital for Best Practices, Patient Satisfaction, out of 1,300 critical access hospitals. How did you do that?
It's a big, important designation. And what that means, Marty, is that the people who stay at Grace Cottage, our patients, do that response on the survey. So they're saying our stay at Grace Cottage is one of the best that we've ever had in terms of places that we've been.
So when we talk about those people, how many people are we talking about? What communities is in the Grace Cottage area?
We serve primarily all of Windham County. We have about 20,000 plus patient visits a year, but we also get second homeowners and people who visit here and people who have family they visit here, but our primary population is Windham County and over 20,000 visits a year.
So not only can I go to Grace Cottage and get my medical care, but we also have ways in which you're promoting wellness.
That's correct.
The community health team.
That's correct.
Tell me what's that about?
Well, you know, and all the people that claim to be authorities on healthcare today say that, you know, really the best way that you can address healthcare is primary care, preventable care, and reaching out into the community in terms of not only education, but mental counseling, drug addiction, diabetes education, food systems. And we have an expanded community health team that reaches out to people in the community to bring them better health care and also to connect to our provider base, our doctors and our advanced practitioners.
Now, I can tell you from personal experience, not from using the hospital, but from my awareness of the hospital, every year I enjoy coming to the fair, to where people come from all around to celebrate the quality of care that they have. That's usually in August.
August, that's correct. First Saturday in August.
And it's just a really good time. But what I particularly like are how everyone comes and they tell stories, and we have selling all the flea market type of things,
yes,
all to benefit the hospital. A really good time. But you also do some wonderful programs, particularly around aging. I know you had one last November.
We had one last November, and you might remember or know that Windham County is one of the oldest aging populations in Vermont and, in fact, in the United States. And so we particularly focus on what are the needs of the aging. And last year we had a conference on aging topics, what's needed in terms of advanced directives, fall prevention, mental health issues, how do you find housing, how do you deal with parents and families, how do you deal with end-of-life issues, and we're going to repeat it again this year on November 7th and 8th, also in Grafton.
A wonderful program, a very important program. But I would be remiss at this point if I didn't acknowledge something that I read, and that is after being practically born in that hospital, or at least being born by the namesake of the hospital, having been steering the hospital for the last 3 years, I read that you're finally planning to retire. Is there any truth to that rumor?
Well, certainly retire from doing this, but not retire from life. And certainly there is truth to that rumor, but I'm extremely proud of the medical team we have at Grace Cottage and also the support staff. And I feel that Grace Cottage is positioned to where healthcare is going, and healthcare needs to go with primary care, preventable care, our community health team. We have a wonderful emergency department that responds quickly and moves people to where they need to go for a higher level of treatment. So I think Grace Cottage is where it needs to go in the future with the team that we have in place.
Okay, and what's going to happen to Grace Cottage without Roger Allbee? Where's Roger Allbee going to be?
Roger Allbee is going to be in Windham County and on the farmland I grew up on, thinking about other things in life that I can do to keep my health going well as well.
So a little mental health for you as well.
In physical health as well.
Okay, but the hospital is in great shape under your leadership, I'm
well,
sure.
it's all a team. I tell people that teams win baseball games, not individuals.
Okay, Roger, I really appreciate your modesty, but I know that many folks appreciate your leadership over these last 3 years, and the hospital is much better for what you've done, and I think much better prepared for healthcare as we go forward.
And I'm looking to working with the team as they go forward so they can keep my health healthy too.
Well, thanks for taking the time to be on the show. We'll be right back with Jorda Daigneault, a nurse practitioner who will hopefully tick you off.
Sunburn moving all day. I got a sunburn moving all day. I burn so critical, can't do any physical. Sunburn moving all day. None of my day is done, cause the sun has gone. I'm redder than a lobster from the boiled box. I cannot move, I can't follow a groove.
Have fun in the sun, but be sun smart. Anyone can get skin cancer, even young people. One person dies of melanoma every hour in the US. You can save your life by using sunscreen, skipping tanning beds, seeking shade, and getting spots checked. This is a public service message brought to you by Mayo Clinic.
Sunburn moving all day. I got a sunburn moving all day. I burn so critical.
Welcome back to Grace Cottage Hospital's Healthcare Matters, a monthly show that brings you timely information about health-related issues. Our guest is Jorda Daigneault, a nurse practitioner, who is here to talk to us about protecting ourselves from tick-borne diseases. Welcome, Jorda.
Thank you.
So I've read a lot about ticks. The Center for Disease Control and Prevention says that the summer of 2017 is the biggest tick fest season ever. Why is that? Why so many ticks?
Well, a lot of it has been attributed to our milder winters. We have, so that makes the ticks a little bit frisky and they don't become dormant. So then they reproduce and then we have more. There's also reforestation in more bushy areas where they like to live. There's also more hosts, such as mice and deer. And so there just seems to be more of them for those reasons.
So there's just been so much written about how to prevent the tick bite, and wear the long pants, put your socks, check on all that kind of stuff. But what should you do if you actually pick up a tick?
First of all, don't panic. Not all ticks transmit diseases. We recommend that you certainly check your skin every night before you go to bed. And you really want to check behind your ears or in the dark places on your arms, in your neck, in your hair, of course, groin, and behind your knees. If you do happen to find one, I have my little tweezers. You're going to take the tweezers and get as close to the skin as possible, and then don't pull it fast or twist it, but just with firm pressure, just pull until it releases. Now the ticks do secrete this substance that kind of makes them cement into your skin, but it's not cement, but it does have them adhere to you, and so it does take a little bit of pressure to get them off your skin. Once the tick is off, you want to wash the area with soap and water, or isopropyl alcohol is fine. If perhaps the mouthpieces are still in, don't panic. You don't have to come to the emergency room to have them removed. They will fall off and they won't transmit the diseases to you.
Okay. All right. Well, then I have to ask this. What happens if I have a tick and it goes undetected?
Well, oftentimes you might not have any symptoms at all, because not all, like I said, not all ticks have the disease. But if you do have some vague symptoms like fever, headache, joint pain, neck pain, nausea, some abdominal pain, then you go in and get checked out, and there's some blood work that we can do. Those symptoms are so vague, it could be many things. It could be a virus, could be other illnesses, but we can test for Lyme disease, Babesia, anaplasmosis, or ehrlichiosis. We can test for those, and then those are easily treated.
Holy moly, so now you're telling me I was already worried about Lyme disease. What are these other diseases?
Well, there are other diseases that can be transmitted, and we don't like to call them deer ticks anymore because they feed off other things besides just deer. They feed off reptiles, birds, mice, and deer and humans. And so the black-legged ticks can transmit those other diseases to you. And the symptoms are very similar to Lyme disease. They're treatable with antibiotics if you do indeed have them. The erythema migrans is certainly diagnostic of Lyme disease, and that's a red area around the tick bite, and it's big, it's not small, it's about 10 centimeters. If you do have that, then we would just treat you without testing you, because that's just diagnostic of Lyme disease.
So Lyme disease, what's involved with treating Lyme disease?
About 2 to 3 weeks of antibiotics, usually doxycycline, 100 milligrams twice a day.
Huh. So is that something I need to show up at the emergency room? Should I call my doc? What should I do?
Yeah, you could follow up with your primary care provider. It's not an emergency, and we can certainly treat you very well in the primary care setting. With ticks and Lyme disease, the CDC recommends that the tick be adhered to you for 36 hours. If that happens, transmission of Lyme disease can occur. We can give you a prophylactic one-time dose of doxycycline, 200 milligrams, and that should hopefully prevent you from getting the Lyme disease.
But if I do have the Lyme disease, it's something that's treatable.
It is very treatable. Mm-hmm.
And I could go to my primary care doctor and they can give me whatever it is. I'm not going to end up disabled or anything like that.
Yeah, it's treatable. Yep, with the doxycycline. And there's if you're allergic to doxycycline, there are other alternative medications that we can give you.
Wow. And what about the other diseases that you talked about? So
anaplasmosis and Babesia are both treatable. They're also, you contract that with the black-legged ticks. There's one that's new and upcoming. It's really the Powassan virus. That's named after a little town in Ontario. There was a young child that died from the disease. It has been only diagnosed 75 people in the past 10 years in the United States, so it's very rare. There is no treatment for that. It's more supportive care, and people are generally pretty sick with that, and they're in the hospital getting treatment.
So when you said before, removing the tick with those handy dandy tweezers, what should I do with the tick once I removed it?
Destroy it. You can either flush it down the toilet. You can stick it to tape and dispose of it. You can squeeze it with the tweezers and dispose of it.
So it's not something that needs to be tested in any way.
It doesn't have to be tested.
I have this vision of me pulling it off and running to the emergency room and saying, I test my tick.
Yeah.
No, I don't have to worry about that.
You don't have to.
Okay, and what about, should I do the same thing in terms of my animals?
Animals should be treated, especially ones that are outside. Dogs, cats that go outside. There's a monthly tick treatment that they can be given by the vet, and that should help prevent them, because dogs and cats can get Lyme disease as well. Check your dogs every night, your cats, for ticks, take them off, dispose of them.
Now, are you seeing, in this, with all the publicity that's been around this, are you seeing people come to Grace Cottage with
Yes.
questions about this?
There's been an increase in patients coming in with tick bites. We have had some people that have had the erythema migrans. We've had people that have had the ticks on for 36 hours or greater, and we give them the doxycycline 1 dose. There's also, they can call in and talk to our nurses. They have guidelines where they can ask questions and then call in the treatment without you having to come in as well.
Wow. So I would be punny if I said there was an uptick in the numbers.
It's true.
Okay. Mm-hmm. And in terms of the concerns that I have, it sounds like what you're saying, despite all the publicity, I can still be calm. I don't have to rush anywhere.
Correct.
There's treatment available for dealing with this.
Yes.
That's fantastic. Now, I should also ask, is there a season for this? I mean, when do I have to not worry about ticks?
Really, it's a year-long problem. We've had diagnoses in January, and the biggest uptick is in the spring, fall, and summer. But there have been cases reported to the Vermont Department of Health in January.
So it's not weather related? I mean,
well,
even
it is.
In the cold they don't sleep, or?
They're less dormant because of the warming trends of the environment.
So it sounds like it's something that I should be aware of the whole year?
Yes.
Wow, that is, it also sounds like it's much easier to prevent a tick bite than to deal with Lyme disease, even though, thank you for reassuring us that there is in fact a treatment for Lyme disease.
So there's some great websites that you can go on to get further information. There's the Vermont Department of Health, and also the CDC. It's www.cdc.gov. And there's a little search engine, and you can just put in tick-borne diseases, and it will tell you all you need to know about tick diseases.
A lot of information.
There is.
Terrific. Thank you, Jordan. I really, really appreciate you coming on the show. I would also like to thank our guest, Roger Allbee, and a big shout out to Jeff Mastriani and Roland Boyden for doing all the magic behind the camera. Thanks also to BCTV for helping us bring this show to you. Our next show, I should tell you, we're going to be discussing back-to-school health issues. But if you have any questions, concerns, or even if you have an idea for a future show, send them to info@gracecottage.org, info@gracecottage.org, and we'll be reading those emails, and who knows, that could be the next a future show. I'm Marty Cohn, and thanks for watching.